record. Okay, so welcome everyone. So we're going to be doing this quick introductions in a bit, but I wanted to say first that to be able to see the speakers, one good thing to do is to go to the right corner of your screen. There's a view, and you can do speaker view instead of gallery view. So that's the top right of your screen. That way you can see our speakers better, and you're able to kind of concentrate on them, as opposed to see, oh, who's here, who's with us. That might be something good. So yeah, so today we're welcoming Kathy St. Marie from the Center for Wellbeing. Is that the right word?
Mm-hmm.
Center for Wellbeing. This is a
Correct.
recent name, right? Was it like last year that it changed names? I was
Yep.
like, did I say it correctly? Kathy St. Marie is our resident expert in insurance and for St. Thomas Insurance. So she'll be able to answer a lot of great questions about what it means to have the St. Thomas Insurance, as well as some of the services that are available to you as a St. Thomas student, and what kind of recommended for you to know about. It's not going to be obviously everything. The website has a lot more information, but it's a good chance for you all to ask good questions about being, how to better, be served here by our Center for Wellbeing. So, Kathy, go ahead and Judy, let us know what you want to say.
Okay. Well, thank you for having me today. It's really nice to get an opportunity. I'm used to doing this in person, so this is new this year, but working really well for everybody, I think. So first I want to let you know, if you have any questions about your insurance, about the Center for Wellbeing, anything to do with that, please feel free to contact me. I'm always available, and I have my contact information. Ozzy has it. It's also on the website for the Center for Wellbeing as well. But love to hear from everybody, and I want to make sure that you all get your questions answered. So we do offer an insurance plan here. So first I'll just talk about the insurance, and then I'll kind of give you a little overview of the Center for Wellbeing. Will that work? Okay.
Yes.
So we have an insurance plan for international students that we offer. It's available for all F1 or J1 students that have an F1 or J1 visa. F1 students do have the option to waive the insurance if they have a health insurance plan that meets our requirement, the waiver requirements. But J1 students are required to enroll in the plan. There's not an option to waive for J1 students. And it's also, of course, available for the IY1 students as well. To be eligible, you have to be registered for class and attend class for the first 31 days. Students normally taking only online classes have not been eligible, but this year due to the pandemic, if you're in the United States and you're taking online classes, you still are eligible. If you're outside of the United States, obviously it's probably not much benefit for you, so we wouldn't even want to enroll you. So you would need to make sure that we know if you're not in the US. And eligible students can also enroll their dependents. So if you have dependents, once you have enrolled, you also can enroll your dependent spouse or children. So that's a nice benefit that we have really strived to make work for everybody. So you're going to get an email, if you haven't already, about either confirming or waiving your enrollment. So if you are confirming your enrollment, you'll want to follow the instructions. You go to the website, which is firststudent.com, and you will confirm your enrollment, and then you'll be sent information from the insurance on how to set up an account through it. And then you can get your insurance card, and you'll also be able to see any claims that you would have processed through that. So if you have any questions about confirming your enrollment, getting your insurance card, anything like that, that's definitely what I'm here for, so make sure you contact me. If you decide to waive your insurance, then you need to follow the steps as well for that. And you need to make sure that your plan meets the waiver requirements. And so that's things like having a US-based insurance company, something that's compliant or comparable to the Affordable Care Act. You have to have active coverage through the end of the semester, and it has to, should provide the evacuation and repatriation benefits. And again, if you have questions, you can always ask after this presentation or anytime through phone call or email. I am working off site, but if you leave a message, I usually can call you back within the hour to contact or to get in contact with you. So just wanted to kind of briefly let you know some common insurance terms that might come up, because the U.S. healthcare system is probably different than most other countries in the world. So when you use your insurance, the good thing, if you have the school insurance, you can come to the clinic, which is on campus in the Center for Wellbeing, and everything is covered 100% there. So if you're enrolled in the school plan and you come in for any visit, anything that we do in the Center for Wellbeing, whether it's a physical, whether it's a mental health visit, whether it's if you're ill or a COVID screening, any of that's covered 100%. So you don't have any out-of-pocket costs. You can't go to other providers. The United Healthcare Network is very broad. And there's information on our website how to ensure that you are in network. And again, I can always help you with that as well. But you're going to incur some extra costs if you go outside of St. Thomas. So one part of that is called coinsurance. And that's, sorry, let me start with the deductible, which is $250. So you have to pay that first $250 of care that you get before the insurance will cover any care outside of St. Thomas. So you need to be aware of that. That's a very low deductible for the US standards, but still it's something you need to be aware of if you go to an urgent care, or if you go something and you have some x-rays or things, you're going to be responsible for some part of that cost. So just keep that in mind. There's also sometimes a coinsurance. So if you did have like an x-ray, for example, you may be required to pay the deductible. And then once the deductible is met, you could have to pay up to 20% of that. So if you ever have questions about that, or you need to get care outside of St. Thomas, again, we're always here to help. The Center for Wellbeing, the staff and health services wants to make sure that you get, really good care that you need, and we want to help you maximize your insurance benefits. Again, there's certain providers that are called in-network, so they're part of this insurance, and there's providers that are out of network that aren't really affiliated with the insurance. So you want to really make sure that you go to a provider that's affiliated with the insurance. And again, it's pretty extensive. It's pretty easy to find one, but you just need to double check before you do that. Again, the care, you always want to come to health services if you can first, because everything's covered 100%. And if we do have to send you out to another provider, we'll make sure that that provider is in network. So the sort of important things to remember, if you go outside of health services for care, there's a $250 deductible, and there's 20% coinsurance that you could be responsible. The plan also provides prescription drug coverage. So if you need prescriptions, you might have a copay up to $25 for most of them. Probably most prescriptions would be $25 and less. Some could be more if they're a prescription that's for a very expensive drug that's not that common. They could go up to $50 or $75, but most of them are under $25. The plan also does not cover dental cleanings or care. So that's important to note. This is just a purely health insurance plan. So you doesn't cover dental care unless you break or injure your teeth, then it would. And it doesn't cover eye exams or glasses. So that's an important thing to know. And that's a very common question that we get if that covers dental. There's different types of care in the United States. So starting with the most expensive is the emergency room. Emergency rooms in the United States should really be left for things that are life-threatening conditions. If you're bleeding excessively, maybe like a broken bone, things like that. If you're very, very sick, and because you're gonna have to pay $150 copay if you go there. So it's gonna be the most expensive. The next option is urgent care, and those are open a lot of times in evenings and weekends. And that's a good place to go if you can't come into health services. That would be a good option. You do have a $50 copay there, which is more expensive, but they are open on sort of those hours where you can't get into a regular clinic. And then if you go to a clinic that's in network, there's going to be a $25 copay. And if you remember coming to always the clinic here on campus is the best choice for you because there's no additional costs, no copays, no deductibles, nothing. And so that's why we always recommend you come here if you absolutely can. But if you can't, there's other options that are going to be some out-of-pocket costs, but we want to try to minimize that by not like going to the emergency room unless you absolutely need it. There's information on our website on how to find the provider network. It's really easy, but again, I can always help you, but there's lots of resources on the health services website about the insurance. There's also information there on how to create your account through United Healthcare. And that will, like I said, give you the opportunity to print off your insurance card or the opportunity to review claims, or any questions that you might have about the insurance are usually easily answered on that website, on our website and on their website. And then you want to also make sure that if you need to find dental care or some other resource outside, we do have a resources page on the health services website. And I know that was a ton of information very quickly, so why don't I open it up to questions? And then let me also just give a really brief overview about the Center for Wellbeing. The Center for Wellbeing is a combination, like Ozzy said it, we just really started this last year. It's a combination of health services, counseling and psychological services, health promotion, and sexual violence. And so we're all located in the same building. So if you have any kind of health related need, that's definitely where you want to go. Health services is staffed by, we have an internal medicine physician, nurse practitioners, we have a physician's assistant, we have a psychiatrist, we have a dietitian, and we normally have physical therapy. Oh, that's been kind of put on hold due to COVID, but hopefully next year we'll be back with our physical therapists coming in. So we have a large variety. We have a full service lab on campus, so we can handle most things. We don't have an x-ray facility for x-rays, so that's something you would have to be sent out for. So why don't we open it up for questions? And like I said, I know that was a ton of information, so please feel free to ask any questions you might have.
Thank you. If anybody wants to ask a question, go ahead and unmute yourself. Please say your name and maybe if you are in the country yet or not, just to kind of help give Kathy some ideas. And then, yeah, ask your question.
Hi, my name is Daniela. I live here in the United States. My first question is about, when do you think we are getting the confirmation email for the insurance?
I'm sorry, can you repeat the first part of that? I heard about the confirmation. I missed, what was the first part?
When do you think we are getting the confirmation email?
Okay. So have you received any email yet, Daniela, about health insurance?
No, I haven't received any email at all, and that's why I'm so concerned.
Okay, have you registered for classes?
Yes, I did.
Okay, so usually once you've registered for classes, let me do a little checking on that, and I can get back to you after this meeting, and I will let you know if you are on our list. And so are you an F1 or a J1 student? Is that right?
F1.
F1?
Mm-hmm.
Okay, you definitely should be on the list. So if you haven't got an email, let me do a little checking on that and then I'll get back to you, okay?
Okay, sounds good.
Did you have another question?
It's about I know you say that the insurance doesn't cover eye exam in glasses. So I was wondering where or what is the best way to actually get insurance for eyes, or to get it the service cheaper?
Okay, so my recommendation would be, there's a lot of places that do lower cost eye exams. So you can even get them sometimes through like a department or a store like Target or Walmart. They will do eye exams there. Those are usually low cost and they have lower cost eyewear. That would probably be my number one way for you to probably get something a little bit less expensive. I don't know, Ozzy, if you have any ideas beyond that for where it might be low cost, but that's where I would go if I was looking for something that would be a low cost eye exam. Some Targets and some Walmarts have an optician, or yeah, I think that's what's optician in there, that can do the eye exam, and they also offer eyewear, and it's usually at a lower cost. And I think you can also get your prescription, and you can also order some glasses online. And that can also be less expensive as well.
Okay. I had other question, but I forgot. Oh,
That's
yeah. Well, this insurance that we're gonna have is United Health, right?
It's through United Healthcare, correct?
Okay. In my last school, I have United Health as well, and they have like a contract. I don't know how to say it with U of M Health. Do we
Okay.
still having that? Since I have United Health insurance, will I have the Minnesota Health like connection in some schools?
So are you talking about like using like the University of Minnesota physicians? Is that what you're talking about when you say?
Well, I remember that through the United Health Insurance, it was way cheaper to go to M Health than to
Okay.
go to a regular hospital.
Right, right. So I believe mHealth that's the University of Minnesota healthcare system,
Yeah.
is in network. And so, yeah, you want to always stay in network. So going to a physician, so maybe just a regular clinic that's in network is always important. And I can always help you verify. So if later you want to get in contact and we want to verify if your doctor is in network where you've gone before, I can definitely do that. More than likely it is still in network because we have a pretty large network.
Oh, okay. Sounds good. Thank you.
Yep.
And before the next person asks a question, I just want to remind people that this is still recorded. So if you have private information you want to talk with Kathy about, I would highly recommend emailing her. We will share emails at the end of the session. You can also email me and I'll give you her contact information if you know my email. So just making sure you know that this is not for private information kind of conversation. Although don't worry, I don't think there was anything shared so far.
That's a really good point.
Hi, my name is Isabella. I already live in Minnesota, and my question is, how are you going to talk about how the payment will work? Do we have to pay all at once, or did you already talk about it? I'm sorry, I was kind of late.
Nope, that's great, Isabella. That's a really good question. So what happens is the premium has already, you might notice, been put on your student account. So it goes on the same account with your tuition and all your other costs from the university. So it's put on there as one lump sum. So like your tuition, you can either pay your tuition all at once, or I believe through the business office, you can, if this is incorrect, let me know, but it used to be that you could spread your tuition out over several payments and you had to pay a small finance charge that was added on. And I believe that's still the same way. So that would be the same way for your health insurance. It's added on as a lump sum. And then you'd have to talk with the business office for those exact details because I am not familiar with that enough to give you the exact details, but I know there's some kind of small interest or extra cost if you spread that out over, I think it used to be you could do it through 4 months. I don't know if that's still, Ozzy says, yeah, that's still the same.
Yeah, but it's also 4, and I believe the finance is very low. So it's feasible definitely if you want to separate your payment into 4 for your per semester.
Okay, thank you. Can I make another question?
Does that answer your question, Bella, or you have another question?
No, I have another question, but yes, it did answer. Okay, my next question is, does the health insurance cover like routine things like do a blood work or things like that?
Yes. So again, if you come to health services here on campus in the Center for Wellbeing, there's going to be no extra charge. And it does cover if you go to your own clinic, although you'll have more, there'll be more out-of-pocket expense for you beyond your premium. But yeah, it just covers, so physicals, all your blood work, all those tests, everything is covered through health services. And you can also get your care outside of health services, but you just need to keep in mind, Isabella, that there's going to be a little bit extra cost for you involved in that. So if you come into health services, so say like you want to do cholesterol screening or anything like that, yes, that would be covered. and, you know, even tests beyond like the routine tests are covered as well.
Okay, thank you.
Yep. I think there was a couple questions in chat. Do you want me to
Just
do
one
those?
question in chat. I'll read that for you.
You read it.
So we have so Abdullah. He's internet is a little weak, so he's writing. So he said, I got an email from UHCSR that says an ID card is available now. Is that does that count as a confirmation for his insurance?
It does, and that will have instructions on how to set up your account and access that card. So I would follow the steps in that email so you can get your insurance card. You can print one off, you can get one put on your phone so you can use that, and they'll also mail one to your house. So you just have to let them know how you want that, or if you want all three, that's fine as well.
And he's also asking if he can pay his insurance payment monthly, but I believe you've already answered that question, which is you can talk to the business office and make that part of your tuition payments monthly, or like through 4 payments.
Yep.
Okay. One confirmation, for those students who are starting in the spring, their insurance doesn't actually kick in until February 1st. Is that correct?
Actually, the insurance starts January 15th, so everyone is currently covered.
Okay.
And the coverage runs through July 31st. So that either if you're graduated, then you won't need it the next semester. But if you are continuing on, then you'll have to go through the process again to activate your coverage for August.
Oh, so someone like Abdullah, who's currently in New York, traveling here, that might not be a bad idea to print that insurance card and keep it in your wallet just in case?
Correct. And it's always good to keep in mind that this coverage is nationwide. So if he's in New York and he gets sick, he can use his coverage there. We have providers in network all over the country.
That's fantastic news. So good for those of you who are traveling. You could probably print that card, even for those coming from outside of the country. It might not be a bad idea to print that insurance, put it in your pocket, just in case the rare chance that something happens during your transit in the United States. It might be nice to have that with you. Okay. Any other questions from other folks? So again, sorry, Abdullah is also asking, that's gonna, he's asking, how can I pay my insurance payments? So those are all gonna be through the business office. So it's all already in your tuition. So it's the same way as paying for tuition. We can talk about it when you come here. We can talk about how to pay for tuition and things like that. So that's not specific to the Center for Wellbeing and Health Services. Okay. And obviously, I'm also going to invite like our, Katie or Ruby, if you can think of any questions that like students should ask, feel free to go ahead. We're trying to get as much information out as possible. What we have, Kathy?
I know it's a lot of information all at once, and so you definitely might have questions later, and feel free to email me, or if you can't find my information, Ozzy can help you.
I have a quick question.
Sure. Hi, Katie.
This might depend on the time of year, obviously, but I've had a few students who have, wanted to get an appointment, and using the My Health portal or calling is kind of the main way, right? You're not doing walk-ins currently.
That's a great question.
And so the follow-up question is, if they were to schedule an appointment, how far out are they able to get one the same day or the next day? Or they have to wait a week or two?
Those are great questions. So yeah, if you, right now, Katie's right. Because of COVID, we are sort of closed down to walk-ins. Usually we have walk-in appointments, but you can either go online through the health portal, or you can give us a call, and we can get you in the same day almost always. Right now, there's going to be a nurse that might be triaging, so she might be asking you some questions. So our protocol is a little different with COVID. So a lot of times we want to do some screening to make sure if you've had any symptoms for COVID, if you need to be screened, but you definitely still can come in and see a provider. Or if you're anxious about that and you don't really want to see someone in person, they also can do Zoom appointments. for most things. So you can also do a Zoom appointment. And then if you need some lab tests, you can just come in and get the lab test done. And you also can, if you want to use counseling, if you have any need to talk with a counselor or whatever, they are not meeting in person right now, but they're still meeting over Zoom. So everything's available. It might be just delivered in a little bit different way right now.
Thanks so much.
Thank you.
I also had a different question. I know I have some students who were interested in participating. I believe the Center for Wellbeing does some yoga classes. Are you all doing them over Zoom now, or?
Right. All of those, all that kind of programming is over Zoom, but you can still do it. Actually, last summer, it was either in the spring or summer when we kind of moved to the online forum, or I did a yoga class, yoga for relaxation, and it was over Zoom. And I just did it right at my home in my, in my living room, and it was really nice, and it still worked out really well. So you can still take advantage of all those opportunities.
Excellent. Other questions that people may have?
Yeah, I have a question. My name is Lopez and I live on campus. So, about yoga. So, I understand that you offer yoga online, but how could someone get the yoga mats?
You could contact the Center for Wellbeing, and they can put you in connection with health promotion, and they will be able to let you know if they may have yoga mats for use. That's a little bit outside of my area of knowledge, but definitely call the center or email the Center for Wellbeing, and someone will get back to you with that information and help you find access to one.
Thank you.
Mm-hmm.
That's actually a good thing, Lopez, that you brought up, is the idea of ask. It never hurts to ask. You can be surprised sometimes by how easy you can get some stuff if you can just ask. The worst you can get is, no, I'm sorry, we don't provide yoga mats. But sometimes you'll be like, oh yeah, we have 10 of them. Here you go, have one. You never know until you ask. So that's a really good question.
Yeah, and usually if we can't answer the question, we can get you in contact with the people that can answer that. Very similar, like with Ozzy, he might not always know the answer to those, but he knows who to contact to get those questions answered. So he's 100% right. Please ask, always.
Sorry, I have one more question.
Sure.
I understand that you don't offer insurance that covering, teeth, but are there dentists on campus or do they come?
Okay, there's no dentist on campus. Usually where we recommend that students go for dental care is the University of Minnesota Dental School, because that's usually a lot less expensive. So these are students that are training to become dentists, but they're supervised by their instructors. So you don't have to worry that they're going to do something that's going to harm you or that they're not prepared. They are ready to start treating patients. And so you're sort of like their practice patients under supervision, but usually the cost is much less, but it sometimes, may be more time consuming, but that's where we usually recommend students go if they're looking for lower cost dental care. But we also have some other dentists listed on our website under resources that also see St. Thomas students as well and are in the general area.
All right, thanks.
One related question to that. So if someone, let's say, just wants to purchase an insurance for dental or for vision, do you have resources you recommend, or they can just shop for insurances that cover that?
They should probably just shop online. I don't know that there's a lot of standalone policies for that. Most of those are provided through employers. You could look. Sometimes the plans can be cost prohibitive, so they cost a lot. So unless you're going to have a lot of dental work, it may not be worthwhile. But you would have to, shop online and look what would work best for your situation.
Thanks.
Yeah.
Any more questions? Don't hesitate. It doesn't have to be about insurance only. It could be anything health related, and we can try and answer. I'm going to give it a few more seconds before I. Oh, there's a good question again from Abdullah. Is there a specific clinic I have to go to, and is it on campus or outside campus?
Okay. The Center for Wellbeing is located on campus. Well, it's just across the street from the Arches, kind of. Walk a little bit down the street, and you're pretty close, so we can get you definitely directions. But that's your first stop, I would say. Try to come to the Center for Wellbeing first because there's no additional cost for you. But there are clinics located all over the Twin Cities that take the United Healthcare insurance that are in network that you can use. Again, you have to be aware that if you go to a clinic off of campus, you will incur some extra cost. But definitely, I'd say try to use a clinic here on campus first. We're really try to give take care of everything we can on campus to not have to send you out elsewhere. And we have a lot of options for care on campus.
All right. All right. Well, if there are no more questions, then we're gonna close this off and finish the recording. I'm actually gonna stop the recording in a few minutes, and then maybe more people will have more questions. But thank you all those for watching the video. Thank you for watching us. They will be in the link to the video once I post it. It will be like a quick email information, Center for Wellbeing website, and Kathy St. Mary's email as well. So you're able to kind of get to her directly, but definitely through the Center for Wellbeing website. Thank you for watching us.